5 minutes.
Thank you, Mr. Chairman. I appreciate the hearing on this matter, although I will note I think we've had numerous hearings with the same conclusion is we're not for sure what we know, but we're trying to find out a little bit more. And near as I can tell from the four folks on the panel, if you ask the question, are we getting good quality care, we're not for sure. Is it cheaper or more expensive in a private setting? Well, we're not for sure. And but I want to follow up and dissect a little bit more. First of all, I want to know from VA, what % of your care is spent on the specialized care that Mr. Blake mentioned?
On the specialized care for?
Mr. Blake made reference to the specialties that are provided by VA that are not accessible elsewhere. What % of your total care is for that type of care?
I'll have to take that for the record and get you a number, which I'm happy to do. I think it depends a little bit on what you put in that category of stuff, but we can get you a breakdown specifically around the.
Yeah, and I understand the difficulty. I mean, that's why we're here today, because that's the kind of question that I thought we'd have a ready accessible answers. And okay, yeah, we know. Is it in 10%, 25%, 5%? Any guesstimates there at all for just for today? I understand we'll get something for the record.
I think it's much higher than actually. It's over 35%, I think, of our total costs go into treating service-connected disabilities.
That's only available at the VA. Okay, and I'll look forward to hearing a little more on that. And I want to turn and ask Mr. Goldberg with CBO. And in the CBO score of the Vet Choice bill that we passed, the provisions dealing with choice, if I remember correctly, $8.16 billion of the cost of that bill was for the Vet Choice over the next 2 years. Can you dissect that a little bit more for the committee? Because as I understood from the CBO report, you don't know if it's more or less expensive in the private sector. And so how do you know it's going to cost $8 billion more? What proportion of that $8 billion is attributable to access, greater access? Or are you saying it's just more expensive? Can you shed a little light on that? I mean, that was a very big number. Yes. And in my district, actually, I believe it's cheaper and better for Vet Choice. But you're saying it's a lot more expensive. Can you describe and dissect?
Unfortunately, I'm not the best person to describe that. So if I could take that for the record, and we could get you a breakdown on that.
I would appreciate that, and do that in light of your statements that we're not for sure. We don't know. We don't have good enough data to compare that. So, I mean, you might come back and say it's all about additional access, all about reduced waiting time. And but because what I hope in the long term is instead of worrying about necessarily what the studies say and what experts in Washington, D.C. say, or some big university, some big hospital, what I'm worried about is what my constituents say. And frankly, in my district is different than others. They're tired of driving 200 to 300 miles for care that they could get right down the road at their local hospital. And the VA has not been very helpful in making that happen. And we're slowly implementing this. But what I've heard lately from the VA is soon that 2-year period will be up, and then we go back the old way of doing things, which is restricting choice rather than expanding choice. And so I would like to allow veterans and their families to make those choices. So if we could find out what proportion of your estimate, again, $8.16 billion for Veterans Choice is a pretty hard thing to pass around here again. And so I want to know what that means in the future and how you arrived at that figure, because I really can't pull that out of the data. One thing I'll note as well for the CBO and the VA and for the chairman as well, I'm glad that you had this hearings, but we've had a multitude of hearings where the summary of hearing after hearing on data issues is the data's not valid and not reliable. And then every time somebody comes back and says, well, we think we know this information. And but the core of this problem was we were being told things as members of Congress that didn't match up with what was really happening. You know, there was no waiting time, that we've taken care of all these veterans, which led to a real catastrophe came to a head about a year ago. So I want to keep that in mind. I look forward to the data from both the VA and the CBO, because I want to put those together. We want to know what's really going to cost. But then, you know, I think the crux of the matter is that we have an entire system in comparison called Medicare system, where you don't drive to one hospital to get medical care in the entire congressional district. I mean, people would be outraged, but we make veterans in my district every single one of them, if they want care, they have to drive to a hospital outside a congressional district. That's 2/3 of the state of Kansas. And my goal will continue to be to make certain they can go to one of 70 community hospitals and get their care that they deserve rather than driving hundreds of miles. So I appreciate and we'll continue to work on this, Mr. Chairman. Look forward to the data from our conferees.